Mrs. Doe. Today I'm going to be teaching you how to suction out and take care of your husband's tracheostomy. Is that okay?
That's okay.
Okay, so I've already washed my hands and did all of that stuff, and I've got all of the supplies here. So you will have a little suction tubing, which is what's going to be going into suction. And then there is an actual care tray that has your sterile gloves and everything you need to help clean it, okay?
Okay.
And then we just have some normal saline right here. So my hands are already washed. He's got his trach shield on, so while I'm getting this stuff all put together, I'm just gonna go ahead and turn up his oxygen to hyperoxygenate him before we remove it. So I did that. I'm gonna open up my stuff. Put on my sterile gloves. And then when you're doing this, you do your dominant hand first and pick up the outer portion of the cuff and slide it on like that. And then you take your 2 fingers and don't use your thumb and go under the cuff on this one. And then clasp your fingers together until you're ready to do it. Then you're gonna get your tubing ready, and you're gonna wanna make sure that your dominant hand is the one that remains sterile, so you don't wanna touch anything with it, okay? And this one remains clean. So this is gonna be hooked up to a longer tubing and then hooked up to a canister for the suctioning portion. And then this part you're gonna use your thumb to cover, is what makes it suction, and when it's uncovered, it's not suctioning. So you're gonna dump your normal saline into here, about half an inch to an inch, and then to make sure that this is suctioning, you're gonna cover it and suction up just a little bit of saline to make sure that it's working. And then before you're doing it, you're gonna make sure that he's ready that we're doing it, and you're gonna assess him for all of the signs of like respiratory distress, which I can go over with you later. And then you're gonna remove his trach shield, and you never want to suction while going in, so you're going to keep your thumb off of it. Using these 2 fingers, you're going to go in quickly but gently until you meet resistance or he starts coughing, and then you're going to cover it and do it intermittently while rotating, and do that for 10 seconds. And then it's done, and while you're doing that, make sure that he's coughing to help kind of get stuff up, and cough afterwards. And then you're gonna re-put his trach shield on. And then you're gonna throw that away. And then if he had an inner cannula that was reusable, you would just take it out and use this to clean it with the normal saline, and then put it back in. Throw that away. And then if it was disposable, there would be one in the package, and you just take that one out, throw it away, and put the new one in. So you've got 2 of these. You want to go ahead and just put those in the normal saline, and then it comes with 4 of these pads. I use 2 of them, so then you just take it and wrap it around your fingers and then dip it in there, and then you just clean around the cannula portion on the outer part of it. Then you do the same thing with the second one, and you want to kind of clean around, getting under the face shield, which is just this white portion right here. And throw it away. Then you're going to take one of these and you're going to clean the actual stoma, so you're going to kind of lift this, and where the hole is, you're going to clean around it in a circular motion. And you're going to want to do this about 2 to 4 inches around the actual stoma, okay?
Okay.
And then you take one of these, which is a dry one, and then you just kind of pat everything dry. And throw it away. And then to re-bandage it, there's one with just a little slit right here. I put it with the slit going down, because if it's going up, it could fall out. So you just kind of lift up on the edge here and then pull down on it, and do that on both sides until it fits around there snugly. And then these white ties, you want to just make sure that you can fit one finger in there loosely, So you can, but if it was starting to get too loose, it does come with an extra tie that you can tie around it. So then you just take your gloves off, throw them away, do your hand hygiene, and then you obviously, when you're cleaning it, you're gonna have his trach shield off, and then if you have to kind of take a break in between and put it back on, you can do that. And then when you're dumping the secretions that you sucked out, you're just gonna do it in the toilet, making sure that you get as close to the toilet as you can to reduce splash, and then turn your face away so that it doesn't splash you if it does splash.
Okay.
Do you have any questions for me?
How do I know how long to suction for?
You can either count out loud to 10 seconds, or a method that I use sometimes is you hold your breath while you're suctioning, because if you are having a hard time breathing, then he's having a hard time breathing.
Okay. Yeah, that's it. That's all I had.
Okay, and then also whenever he's going outside and stuff, just make sure that it's capped to help keep the cold air out and any dust to keep it clean as well.
Okay.
Okay, thank you.